Hello and greetings from your very own RFA tutors, your mentor this side. I hope you all are doing great. Thank you very much for joining in, a very warm welcome from the entire team of RFA tutors, your mentor this side. I hope my voice is audible and clear to all of you out there. Thank you so much, Kishore. Happy to see you guys. Naima, Sunin, Mumo. Thank you very much, Amina Zafar. So happy to see you, girl. Thank you so much, and a very warm welcome to all of you. Hi, Sreja. How are you doing today? What a lovely start with so many roses and so many flowers. That's my favorite. Thank you so much, Karima. How are you doing, my dear Falda? Thank you. Warm welcome to all of you. Yet another journey. Thank you so much, my love. Soon we are going to start your Oshki as well. And thank you very much to join in for your buddies today and encouraging them to start off like you people did. Thank you so much. The backend team, if you could write in for Miss Ali that she can get connected to the audio. She's not. Thank you very much. Hi, Nadia Mariam. How are you doing today? Big hello from RFA. Thank you so much. Hi, RMS. Walaikum assalam wa rahmatullah. Hello, Natalia. How are you doing today? Thank you so much, girl. Thank you, Shweta Happy. Thank you, Sophia. Please get connected to fine internet. I hope the voice is fine. Yes, it's audible. Sure, my dear, my pleasure. So we all the obstetricians and gynecologists, we are used to of handling so much of a stressful situation, isn't it? So I always say to the students that the actual personality, that comes up when you are under stress and your performance, that's evident that what exactly you are when you are under stress. Would you guys agree with this? Yes? So today we are taking another step to be organized, to be composed, to do a hard work, and yet being hands in hands together, being successful as well. We are meeting today. Thank you so much, my dear Shardam. Thank you so much, Alaya. Thank you, Kishwar. So I hope the voice is clear, please, Babita. Everybody, please give me a thumbs up that the voice is audible and clear to all of you out there. It's clear and loud. Thank you very much, Sunin. Babita, please check the connection, sweetie. Thank you, Hiraro. Shazia, thank you so much. So we are meeting today for the introduction of MRCPI. I want to talk to you about what exactly it is because lots and lots of queries we were getting about why should we prefer MRCPI, what's so different from MRCOG, how much we need to prepare when it comes to MRCPI. Lots of queries were there, so we thought that we should meet up for the formal start of the March 2024 course. So the moderators, the backend team, the coordinators, everybody is here to address your concerns and queries and to take all the questions. And a tiny update of year 2023, I'll tell you to give you a glimpse, just to tell you that how the study pattern is going to be after you've done one of the obstetrician and gynecologist degree, how you just add on to the information and you add these four alphabets saying you are MRCPI. All right? Okay. So I'm going to touch that why to take MRCPI Part 2 written exam, who is eligible to take this exam, how we have to prepare for MRCPI 2 written exam, why the students can be a situation where they can fail in this exam, how to just make it in one go, and then I'm going to talk about what course schedule will be, how we are going to take it further. So many students have passed. We crossed 100 in last March 2023. Then we crossed 100 in the September 2023. Just a round of applause together with those shining stars. And we are going to take them to tell you that how they passed this exam and how do they feel today. so much. We remember every bit of the effort that they have made, and this round of applause was just to tell that how important it is to remember the hard work. They also started as an introduction. There was a day when they were also having lots of questions, and they all then worked hard, and 3 to 4 months, I always say, is sufficient for this exam. To the idea behind starting this way is to tell you that introduction is always the first day when we take an oath that we are going to study together, hands in hands with the hard work, and you people would see that you people will be one of the champions in March 2024. Before I begin and I take it further, I would like the shining stars who have just recently passed this exam tell you something that how they started, and then I'm going to tell you the point of view of a mentor, point of view where the students they stand, and how you have to rise up being champions. Thank you very much. I've got Bushra Patel from India. Hi, Bushra. How are you doing? And how does it feel being in the champion list for the September 2023, sweetie?
Hello, ma'am.
Hi, sweetheart.
Missing you.
How
Yes,
are you
ma'am,
doing
missing you.
today?
I could not believe, ma'am, that I could be in this champions list, but it was you who instilled that in me. And I think last time I was listening to the champion who had gone passed before us.
March 23, yes.
Yes.
Thank you so much. So, how would you guide students? Because today it's the first step, Bushra. I want you to give a student's perspective. I'm definitely going to give a mentor's perspective, but as students, they all want to know that you were there 3, 4 months earlier, like they are going to take a start today.
Yes, ma'am. Ma'am, actually, I had only 1.5 months to study for this MRCPI exam after my Part 2 MRCOG. So I was not sure earlier whether I would be able to do, but you told me like this is if you have read all the guidelines for Part 2, and then this will be just like a few differences which will be you have to concentrate on, and which you have made very clearly in the live sessions, the Irish guidelines, what will be the differentiating part from RCOG guidelines. And then I could do my, I did the summaries from the portal, like whichever the new guidelines were there from the Irish college. And the ebook helped a lot because you have collected so many SBAs into one place, and we could revise it, and we could do it fast. We did not need to do many books together.
Correct.
And the most important was the moderators, Binte Hawa and Dr. Mahira, who helped us like throughout 24 hours. They were there for us.
Absolutely. Thank you so much, Bushra. And I would just hope and pray that all of these students they follow the footsteps of you, the September 2023 batch, and all of us they just make another wonderful result. And thank you so much for your wishes.
Yeah,
And
they
thank
will
you very
surely
much.
do it, ma'am, under your
Thank you
guidance.
so much. Thank you. This was Bushra Patel from India. Thank you so much, love, for joining in. I've got Shazia Shahid here. I've got Samina Zafar
Thank you,
here.
ma'am.
They're also one of the shining stars. Hi, Shazia. How are you doing, my dear? How would you
Yeah,
suggest
hello,
your
ma'am.
upcoming students? Hello. Yes, please, my dear. They would love to listen to you because what you people have passed through, your experiences, they mean a lot for them because they are taking the first step for the March 2024.
Yes, of course. First of all, hello and greetings to everyone, and best of luck for your coming exam. And I must say that I'm very happy today to be the part of to have this honor to give my opinion. Otherwise, I wouldn't be thinking like this. First of all, I would like to guide all the colleagues that everyone is knowing that we are busy doctors, and being females, we have many tasks to do. We have our hospitals, our clinics to take care of. We have our households, our children, and besides all of these, we have the aims in our hearts that we someday will get the degree made with a MRCOG or MRCPI. So I would suggest that every dream which has to become true, we need a teacher or a mentor in our life. And I must say that the RFA tutors and ma'am Sidra Ali are the answer. And seriously, ma'am, what I did I took my initially I took 4 to 6 hours of my day, and then
Hmm.
near the exam, I devoted my 7 to 8 hours a day in studying. I would
Mm-hmm.
like to say that the hard work is very necessary.
Absolutely.
The students should study hard. They should study each and every guideline. And I must
Hmm.
say that the schedule which was given by in our course, that was tremendous, because
Hmm.
everyone has knowledge, but the right way in which you have to follow the right way is provided by your team, ma'am. Every day you provide us with the guidelines that we have to finish them before your online session. And I
Mm-hmm.
would suggest that every student should complete that 1 week's whole schedule before listening to your live sessions. And
Absolutely.
although your live sessions are enough, they have plenty of knowledge, and they are more than sufficient to clear this exam. And I must say that it's a doable exam if you follow the schedule provided by you, and listening to the all the live sessions and recalls, and definitely the ebook. And I must say that religiously, you have to work hard. You should take everything aside at one side and focus on your studies, and just follow the schedule which is provided by Ma'am Sidrali, and daily basis you have to cover the schedule, and day by day, bit by bit, at the end of the course, you will come to know that you are equipped with the enough knowledge which is sufficient for passing this exam. Because I must say that it's not an exam which is out of this world, but you need a guideline, you need a path which would lead you, all of you, to the success, inshallah. And
Thank
just follow the path of Ma'am Sidrali, and you would all would celebrate your success at the end of the day,
Thank
inshallah.
you so much, Shazia. And I would tell them about the daily schedule, which we make after so many meetings all together. It's not that we make a schedule that, somebody is making and we don't know. When the moderator makes a schedule, then we have a meeting, then we sit together, then we make amendments, then we see that what are those things which have to be added, what are those things which are just being overburdened, what are those things which are just updated in 2023, how to just reinforce them 2 or 3 times. So it's a huge lot of effort at the back. That's why I always say that when you are following the daily schedule, you are basically aiming for 3 to 4 revisions, which we aim for because we have passed through the same path and we want you to be super easy in your preparation. Thank you very much, Azia, for your emphasis, and I'm going to guide them for the same today. Thank you so much. Samina Zafar, spectacular results. She was one of the toppers in MRCPI, getting highest percentage. And she has been very hardworking, but every concept she used to just ask the questions, very, very interactive in the live sessions. She used to be. Warm welcome, Samina, and thank you very much. I am going to take you. I know the OSCE is going to be day after tomorrow when we are going to start the preparation. What would you like to guide, sweetheart, for these aspirants? And what was your key? And what should they do when they're taking the first step today? Warm welcome,
Hi,
sweetheart.
hi, hi, ma'am. How are you?
I'm okay, my dear.
Good,
Thank you so
good,
much.
good evening to all of my friend. I simply say that they are blessed people who got the right path, ma'am. Really, I have listened a lot of students around me because I have passed my FCPS and MCPS, and then to pass the MRCOG and MRCP is actually the my dream. But I have heard a lot from the people that they fail many
Mm,
time because they failed many times because they not choose the right path, right mentor, right teacher, because they are doing I think so self study or by guiding some seniors. They are providing the old material, old guidelines. I was
this is
scared
I want to
how
emphasize today, the thing which I've brought today here, my dear Seema, that is something which is just updated in September, and people they don't know that entire recommendation of chickenpox has changed. So I was discussing with the moderators that we are the first one maybe to read, but then they should be knowing that so many things are changed and updated. So being updated in these exam is the most important thing, which students they miss out. Yeah.
Yes, ma'am. Yes, ma'am. Because they people create a hype that it's an undoable exam. But, ma'am,
Mm.
one day I was just thinking I must do MRCOG. I just go to Google the best MRCOG tutor. I found
Mm.
RFA tutor. Nobody really, ma'am, guide you that RF is the best one. The ma'am will guide you better rather anyone else. Ma'am, people have made some fake groups giving the fake material, and they're
Mm.
given not right path, not up to date guideline. But
Everybody
I'm the
is doing a
luckiest.
good job. Yeah, but what my concern is that we need to have a pathway where we work hard, we know what is updated, judiciously try, and then leave the rest to the Almighty, you know. But hard work, we don't have any shortcut to it, actually. So that is the most important thing. So how was the preparation like? Now, Samina, you have done that, right? Now, my
Yes, ma'am.
question for these students is how much time is sufficient for MRCPI as a student prospect?
Ma'am, as we were doing the study of MRCOG Part 2, you just motivate us. You are our mentor and our, you may say, you are our supporter in every way. You want your student shining, like you guide us that you people can do MRCPI as well. And it's not a big task for the students who are getting preparation of MRCOG Part 2. We
Mm-hmm.
just took 2 months to do it. And
Yeah.
your team and ma'am, really it was a marvelous hard work. I really can't see such mentor and such institute who really want their student to be on top. And ma'am, the portal you provide us is speechless efforts, really. Or
Great.
whenever, ma'am, your hardworking team do a lot for us, I always feel pain that we have to make our ma'am proud. Their your work hard is speechless. I can't, ma'am. If you will say, I should say some in words. Words are not sufficient, really, ma'am. It's a passionate association with RFA Institute with me. I can't forget. I can't narrate it into words, really.
Thank you
The
so
hard
much,
work
my
people
dear.
doing.
So you all have proved to be the best. I need prayers for my upcoming aspirants that they just come up with the best of efforts and they are successful. We have to prove ourselves to be the best friends, and with the blessings, you all have to come up with all this hard work together, hands in hands. After MRCOG, everyone, yes, 1.5, 2 months are sufficient, and I'll tell you how this is possible. Thank you very much, all those students all over the world. Yes, all my Irish students. Thank you so much, Naima. I got just now in OSCE, I just came to know about the same. I'm really humble. Thank you so much for all my Irish trainees who have joined in. Thank you so much for all over the world who people have faith, the Gulf students, the Asians, and all those Jordanians who are joining in, and all those Malaysians who are joining in. A very, very massive thank you from our FA tutors for all this love and faith. The way you people have turned up on the live OSCE has shown up all the spirits, and we are grateful for all this love. Thank you very much for reaching out to wish good luck to the upcoming aspirants. Thank you very much. Thank you.
Ma'am, we will make you proud in OSCE as well,
Oh,
inshallah.
yes. Now, next talk, you people have to make me proud, and we'll start
Yes.
working hard day after tomorrow.
Yes,
Thank you so
ma'am.
much.
I'm studying 8 to 10 hours nowadays. I will make you proud,
Absolutely,
inshallah.
girl. Day after tomorrow is the OSCE introduction, and I'm going to take all the sessions, and we'll just reach out to the best of our efforts, God willing. Thank you so much. Thank you, my love. All right,
Thank you,
guys. So
ma'am. Thank
thank you
you
very
a lot.
much. God bless
Thank
you.
you,
Thank you
ma'am.
so much. See you guys in the introduction for the OSCE, my dear. Thank you. All right, everyone. The idea of bringing up the older successful champions is that wanted to tell you that this is not something out of this world. People had been enjoying the study group. It's just like a family. You people would feel such a strong bonding. It's not that we are doing it somehow like for the sake of that strict atmosphere. Yes, I'm notorious to be strict at times when I feel that the output is not what I want. But at the same time, I understand one thing, that togetherness brings up the best of the efforts, the best of the response, and the best of the output is when we are together. So you people have to learn all this, and I would make sure that this MRCPI family, as a batch of March 2024, not 1, not 2, not 3, the entire batch has to work hard together to make it a success. The question here by Aramu is that please in this class sufficient for MRCT Part 2 as well. Unfortunately, no. MRCT Part 2 has got certain guidelines which are not in Ireland, and those recommendations are different. So January 2024 or July 2024, you people can have MRCOG course, my dear. Thank you very much. Saida Sitwat, we have started the MRCOG Part 2 January. Of course, the fast track is starting in next week, and the July 2024 is also started. I think 100 plus, we already have the registrations to start with who are doing the quiz, and the first read is started for July 2024, Sayed. Okay, Sitwat, got it, my dear? All right, so now the question starts, why to do MRCPI? Now, the story is that students are stuck up at times. Of course, the MRCOT is a big journey, and at times something in extended match question, they're stuck up, they don't have that sort of a click, and they have a little concern regarding having a shorter pathway. Many of them, they want to reach out and establish in with a GMC registration in UK. So lots of different concerns are there. Maybe in the Gulf, they want to have some sort of a better attire, of course, with some specialist degree. You can be a specialist with this. So an internationally recognized qualification it is in obstetrics and gynecology. And the most important thing is that it is another pathway for GMC registration. I'm not sure that you guys are aware of that or no. The MRCPI in obstetrics and gynecology is a qualification that's recognized by General Medical Council in UK. So this means that international medical graduates, they can apply for a full registration. Many of the students after MRCPI, they're working in Ireland, they're working in the United Kingdom, they're working in the Gulf regions as specialists. So all these things that are important that you should be knowing, that it opens up a new horizon. It started up by 2 years back, basically, when we had this pathway. So it was a welcoming decision by RCPI President, Professor Mary Hogan, and I quote, that this is a significant development that widens the training and employment opportunities for doctors who have achieved our postgraduate qualification. Our college has always had strong links and excellent collaborative relationships with our colleagues in UK. This is further recognition of the high esteem that our membership exams are held in as a mark of attaining
बैठ के बनाओ
high
के 12
quality
बजे तक मत
medical
जागा कर
training.
चल अभी बैठ के पढ़
Professor
इंसानों की तरह
Argan said. Everybody, please, I would request to be on the mute mode. Thank you very much. Thank you. So this is the first thing that gives you a pathway that you can have your GMC registration. So one path we have is the MRCOG route. And the second path, if you're not getting seats, if you want a quicker, or if you want, don't, you know, we all did it in add-on. MRCOG. Can I request mute mode, Homera, can I please request to be on the mute mode, sweetie? Thank you so much. Thank you for understanding. All right. So this is the reason that students, they aim this exam. And the second reason is they just want to add on. Of course, I always say one thing that, for example, Sitwit, Samina, Alia, anybody has to go. You have to take your kid, you have to take your parents, anybody to the doctor. What is the first thing you see? You always count the alphabets after the name. Am I right? Am I right or wrong? You always see how many alphabets are there, student. Is that right? So with the same preparation, you've done your MRCOG, or if you've done any of the obstetrics and gynecology qualification, with the same, if you add on few alphabets, so it adds on to an impression that yes, you're better qualified than your colleague. Yes, so this is one of the reasons. 80% of the curriculum you already cover in other exams. You just need to add on that 20% for which you can just take this exam. The exam paper, that is only one instead of two, which you're taking in the European board or you're taking in MRCOG, there's only one exam, right? The duration of the exam is 3 hours. The questions are only single best answers. Now there are 100 in number, and they've got A, B, C, D, E, 5 possible answers, and there is no negative marking. This makes it comparatively easier exam as compared to MRCOG. When we talk about MRCOG, we have 50 single best answers and 50 extended match questions. And extended match questions are a big nightmare for the students. So we know that we've got 2 papers. They're quite exhaustive. We need to travel and we need to reach out to the Pearson Center to take that exam. And then we've got lots of guidelines as well, which we need to cover, including the talk articles. So in comparison to that, we have got MRCPI, where it is 1 paper only, and guess what? It is from your home. I mean, you need not travel to any of the center. It is only sitting at your home, of course, a separate room, but you don't have to travel for MRCPI written. Definitely, yes, you need to travel for the OSCE, but OSCE also they're having in Ireland, and it's being done in the Gulf region as well. Last time it was in Riyadh. This time it was in Al Ain, United Arab Emirates. So they do keep one of the Gulf region. Next time in February, they're having Oman as a center. So they keep Gulf region for the people who are nearby, living nearby, and the ones who are in UK or Ireland suits to them. So OSCE is on site. Srija, OSCE is for you. UAE would be the nearest. Next time, February is in Oman. Then again, it's in UAE and Riyadh, KSA. So these 3 centers. The one they keep in the Gulf region, Srija, and one they keep in Ireland, my dear. All right. So this is the nearest. Okay. It's a very difficult question, sweetie, that how much percentage is passing because it's a competitive exam. Did you see the percentage of the toppers? By toppers, they had 80% and above, 82, 83. There have been maximum people around 75. Now, when you are between 70 to 75, you're safer. So this is doable. This is what people are getting. That means that this is something which is we can achieve, right? So this is the exam pattern, and this is the comparison. The second question which you all have, I just had a message a little while earlier from Kingdom of Saudi Arabia, and thank you very much, Sitwa, that was coming to this question. Just 10 minutes before starting the session today, I got a message from KSA. The message said that, ma'am, you're taking the introduction today for MRCPI Part 2 written. Can I know that how can I prepare for MRCPI 1? So my answer was that, girl, you are in MRCOG 3 and you can take it directly. This is what you guys need to understand today. If you have the following qualifications, which are on the screen at the moment, you can take MRCPI written Part 2 direct. Sitwet, anyone who has MRCOG Part 1 exam result passing can take direct MRCPI Part 2 written. Somebody who has got an obstetrician qualification from Australia, from New Zealand, from South Africa, or the fellowship from Pakistan or from Malaysia qualification, anyone has got these qualifications is eligible to take the direct exam MRCPI Part 2 written. What they do is that when there is eligibility opening up of the registration, you attach that result, and that makes you eligible to direct take the MRCPI Part 2 written. Am I clear? There's no limit or expiry, Maliha, but one thing is that you should have a result. There are certain exams which make you eligible for exemption of MRCOG 1. That is not accepted, sweetie. Okay, that's not accepted. You need to have a result of MRCOG Part 1. Got it? Yes? No problem at all, my dear. You can take it with this result, provided you've got a result, not an exemption. Exemption is not accepted by the Irish College, please. Can I make myself clear? Yeah, exemption is not accepted. You need to have a result. I mean, you've appeared in MRCOG Part 1 and you've got a passing result with you. Afreen? Yes, Hibatala? Clear? Now, the second thing is that what do you guys need for the entry criteria? So you need and 18 months of certificate. Anybody who has got an assessment of training for the MRCOG Part 3 definitely is eligible for MRCPI. Absolutely, Ghazala. Yes, Ghazala Shaheen. Why? Because what you need is 18 months of your post-registration training. It can be 9 months in obstetrics, 9 months of gynecology. You can take immediately, my dear. My dear iPhone, apologies, I cannot see your name. There's no time limit for that. You can take any time. Yes, provided you've got a result of your MRCD Part 1, you can upload that. All right? Okay? Thank you very much, Ghazala. Yes, you can tell your friend. Absolutely, she can appear. So 18 months or less. You know that assessment of training. How much assessment of training we all have when we were appearing for the AOT for MRCOG? Srija, how much it was? Everyone, it was 4 years, right? So when we have 4 years for MRCOG, here it's only 18 months. So anyone who has had a qualification from any part of the world definitely has this minimum obs and gynae exposure, right? So you just need to put that, Mariam, you just need to put that experience certificate. That's it. Islam, for you, I'm going to tell you, you just get connected to me privately on the WhatsApp. I'll tell you what certificates you need. I know, yes, I know about you that you've just started your house job. I'm just going to tell you about that. Okay. The foundation year is included. No worries at all. Okay. As a senior house officer, I will tell you about that. Okay. So now, one thing which you need to remember is that there is one more form. Sure, Hebatala, just drop in a private WhatsApp, I'll tell you. So we are basically aiming for the next exam, which is on 7th of March, year 2024. Right? So, sure, my dear Karima, just drop in a private WhatsApp. So the location is, again, it is going to be worldwide. It is going to be a test reach application for you guys. And we are going to start the applications on 6th of December, year 2023, that makes Wednesday. Now, we are expecting the opening date on 6th of December. Before that, in the study group, the moderators, the coordinators are going to make your scanned copy all ready, and you're going to get it checked by the team that you're all set with your documents which are needed for the uploading. Because it's a computer-based application, you need to have each application ready in terms of the documents and then scanned and make a folder. We make sure that your folders are ready so that you don't have any confusion. On that day, it's a click and uploading. And team is super busy that day with all the students. So what you need at that point is, as soon as the applications would open, you will find Myra, Bimpe Hawa, Safa, the coordinators, the website team. Everybody would be there to guide you, and they would make sure, because prior to that, all your folders are ready. When all your folders are ready, you need not worry, because you just need to upload the documents. Is the time in the premium group, you people would find that we will check the testimonial forms, we will check all the degrees, eligibility, and the experience certificate, and then you'll make a scanned PDF and you will combine them together. This is what we are going to do in the premium group for all of you. Okay. Now, anyone who is taking as a reset exam, generally the option doesn't show to them that you have to upload the documents, because when you enter your number and you get into the same system again that already has your previous documents. If you are a reset candidate, then you generally do not get the options of re-uploading, because that shows already in the system. But if at all it does show that you have to re-upload, you should be ready with the documents. So if you're a reset candidate, be ready with your folder. If it gives you an option and a prompt that you can upload your documents, please do that. If it doesn't, so then you just have to fill in the application. That's it, and the date. That's it. Okay, am I clear, everyone? Yes? So now you have to understand that when they would give you the link and when it's going to be started, there will be one testimonial form which you have to upload. So now you people are going to prepare your testimonial form. Are you all having the testimonial form? Do you all have the testimonial form which you have to upload? That is given on the website, and the team has it as well. Please drop in a message in the group. You can write in the open group. can I request the backend team to give this testimonial form? This is how it looks like. You all can ask in the premium, and the moderators and the coordinators are there. After the session, I can respond to your queries as well. So you need 2 doctors. Anybody can sign it for you. They should be doctors. Now, they will write their names in the block for case capitals and then their address, their working address. Anybody can be there. There are going to be 2 doctors who basically are giving this as a witness that yes, they know that yes, you are a doctor and you have been working and this, right? This form, after getting signed by these 2 doctors, you're going to keep a scanned copy in your folder and you will upload the day when the link would be opened. This would be one of the form which you need to upload, but we can't prepare it on the final day, right? We have to prepare it today. All right. Okay. If MRCOG1 exemption is there, then you cannot take it on the basis of MRCOG1. But if you have the other list, you can take it on that basis, my dear Sitwith. Okay. You can take it on the basis of other qualifications if you have. Right. Now, am I clear about the testimonial form? I've got some sample testimonial forms as well. So after hiding the names, I can show it to like various students. They keep on having the check. So I'll tell you exactly, or you can get your testimonial form checked by us that this fulfills the requirement and this is what we can assist you with if it requires any change, right? Then you are going to have a scanned copy of this and put it in the folder and save it on your desktop or in your laptop. The day when it would require to be uploading, then you're going to upload from your gadget. Is that okay? Absolutely, Sitwat. Yes, my dear, you can do that on the basis of your fellowship. All right. Ahmed Hussain, there are certain, for example, Ahmed, if you've done MRCOT 1, you get exempted to take MRCPI 1. Ahmed, you get this point? Yeah. Similarly, thank you very much. Myra is here, guys. Myra has already shared the testimonial in the MRCPI group. Thank you very much. 24/7 available. I'm so grateful to all the coordinators. Thank you, my love. Thank you very much. So what you people have to do is that you people have to prepare the testimonial in these coming days and make your documents ready so that there's no last minute confusion in that. Okay? Now, what you need for the documents is you need an attested copy of your primary medical degree, right? Then you have a recent color passport style photograph. That should be a recent one. There should not be too much of a difference because the same photograph they use for your eventual check when you're appearing in the test reach as well. Okay. Then copy of your part 1 result or the equivalent qualification you need to upload, like MRCOT part 1 result or your fellowship or your qualification from your country that makes you eligible to sit in MRCPI part 2 written. Okay. Attestation can be by anyone. Yes, it can be by a gynecologist as well. It can be by anybody, but they should have their qualification number, right? A testimonial form would be uploaded by 2 referees, which is already given on the website, which the team has provided to you in the open group and in the premium group as well. Am I clear? So all these things when you're ready with, so basically now before that, you have to get ready for all these documents. If you're ready with all these documents and you've made a PDF and a scanned copy is with you, then you're all set for doing the registration on that day. All right. It is better, Sunan, that you do it. I mean, it's always better to have all the attestations. Yes. Karima, if they won't mention, they would require it on that side. You have to write it down. So Myra has got the screenshots of all how it looks like while uploading. We'll share that with you guys as well, that where you have to put in the experience. The hospital names, they come in the click. So you should be ready with this, Karim, right? These 18 months are mandatory. Okay, right? There's a special block where you have to just fill it. Okay, can I submit by typing or handwritten? It's handwritten, my dear. Alicia, it's handwritten by the doctors who are the referees, 2 doctors. Okay, got it? Yes, up till now, any question? Now, if I compare all the obstetrics and gynecology, MRCOG experience of MRCPI, experience of the European board, and experience of the fellowship of United States of America, FACOG, out of all the exams, I consider this exam comparatively easier because of the exam pattern. Because of one exam. I'm yet to listen to any student after MRCPI written exam that, ma'am, this exam was exhaustive. This is not an exhaustive exam, honestly, but there are certain difficulties which they do face, which we have to address today only without any confusion. Whenever you're taking an exam, you should not have any sort of a confusion, foggy mindset, shaky attire. If you're preparing, I need 100% because when you are 50-50, of course, we cannot expect a success when we ourselves are not confident deep down inside. So, the first thing which you have to be very sure is that you should have a very solid and a composed mindset. You should not have a non focused preparation, which definitely is our responsibility. You should have an examination strategy that how I'm going to revise everything in 3 to 4 times and how I'm going to cope up with the final examination stress. These problems, we need to find the solution for all this. All the formats, Alicia, is going to be in your premium group. If you just have a look there, the moderator is going to put everything there, and you can have your individual check of your documents with the coordinators as well. Okay? Now, you need to have a very clear plan and understanding that how I have to get to the focus study. That includes your daily schedule. If I say that you have to do one guideline per day, honestly, I mean it because less than that, we cannot expect a success. There should be a dedicated time period which you have to give to your studies in a day. If you can't give in that day, I expect that you give it one day earlier, one day later. Preferred is always one day earlier. That if tomorrow you're busy, you're going to a birthday party, you're having some wedding ceremony, you're having some occasion, Diwali is coming, Eid is coming, Christmas is coming, you know these dates. You have to do your schedule 1 or 2 days earlier to make your that day free so that you can enjoy with your family members and your loved ones. This is how a good student is. This is what my expectations from all of you is. It is possible, but then I need a very organized student who actually is knowing that how to prioritize myself, how to give ample time to my kids, how to give ample time to my husband, to my wife, how to give and organize my kitchen, my chores, household, my hospital. We need to make it a lifestyle, please, in 2 to 3 months to make it a success. Time management is very important. It's comparatively an easy exam, but I would never say that without preparation or without putting in an effort, you can be successful. Do you all understand what I want to give an impression in terms of a starting point today? I want your next 3 months to be very, very clear that how we are going to do it in preparation. Yes? Absolutely, my dear. iPhone, I can't see your name. I would be grateful if you just write your name so that I can communicate. It is doable. I did it in 35 days after MRCOT Part 2 written. Okay, so what you need to do, I'll just give you a glimpse of that, and you people would understand just now. You can go to the YouTube, you can see my diabetes, you can see my molar pregnancy session, you can see all those where I've compared it with your green top guidelines and the MRCOG, and you're so clear that what exactly are 2 to 3 points you need to remember extra. So, what do we do in the curriculum? Now we have got Irish guidelines, and the college has done so many updates in year 2023, and they made an email to the OSCE students, I think week or 10 days before, right? That they want all these updates that students they should know. And yes, they gave that in the recent OSCE just 3-4 days back. Right? So there are 2023 updates. One of the update I'm going to share with you guys today. So nobody can change obstetrics. Exactly. See, Myra is confirming that 2 weeks before exam, all the candidates, they got an email that these recent updates should be well revised and rehearsed before coming to the OSCE, and they gave all these guidelines, which are the recent updates. Now, we've got specific Irish guidelines, which are must to be covered. Then we have got the Green Talk guidelines, those topics which are not covered by the Irish guidelines. We cover the Green Talk guidelines, the NICE guidelines, the talk articles, and the Faculty of Sexual and Reproductive Health as well to cover up the contraception section. All right. We do not have any specific book which is separate to that of MRCOG. We've got the same books, which is the Andrew Sizer. We've got the same book of Amanda Jones. We've got same Sajanesh Gupta. We've got Mastering, so Mustafa's book. We've got again an older Andrew. We've got the same Succeeding. We've got Sakunjay's book. We've got Satahir Mahmood's book. All these books are there. And we just need to remember that the same books we have for the single best answer, which you have done, or you would do later for your MRCOG Part 2. With this, we have got our own RFA MRCPI book where we have, absolutely, Manahil, you will have all the books scheduled there. So you have, whosoever has to do the attestation, there's a list, Shruti, you can write up for your place. So Amira can guide you on that. Okay? So she'll guide you exactly that what attestation suits you and is safe for you, my dear. All the book schedule you get, and you will do the book practice with the coordinator, with the moderators together for all the single best answers. Now, the question that comes to me is that, ma'am, shall we practice the extended match question? Now, if you ask me, SBAs are SBAs, but once you've covered the single best answer, yes, you can do the EMQs just to have a hang of the topic, not for the practicing of EMQ, but just to be sure that you can just make the points clear. An additional practice. But if you do 15 books and SBAs of those 15 books with changes which I make, there are certain guidelines which we have to be very, very clear on, which are changed. Like we have got absolutely different fetal growth restriction in Ireland. We have got absolutely different recommendations. Stress urinary incontinence, guys and gals, what is the first line treatment? Where are my MRCOG students? Manahil. Yes, Alicia, what is the stress urinary incontinence first line? Srija. Sumaya. Thank you very much, Maheen. What is the treatment of choice? The first line surgical treatment is which surgery, Muna, for the stress urinary incontinence?
Ma'am,
Yes?
TVT. TVT.
That's an older one. For the MRCOG, what is the recommended one? I'm talking about MRCOG. Thank you very much, Faika, my girl. It's birch copper suspension. Right? We have got birch copper suspension. But when we come to MRCPI, they say duloxetine is first line. So these type of changes are there. MRCPI, the Irish recommendation, they say that we will give duloxetine, which is second line in MRCOG, but it's first line in MRCPI. These type of changes are there. And one of the change I'm going to tell you just now in 2023 chickenpox update. So the entire guideline would be the same, but these changes, and let me tell you that things which are changed, 100% they come up in exam. When they have umbilical artery Doppler change, 100% that comes in exam. When they want that in a previous one cesarean section, ECV should not be done, it should be a cesarean section, they would definitely give that single best answer. They ask you about the first line in stress urinary incontinence because it's a recent update. This is where I am going to make a difference in the sessions. I will cover the entire guideline, but I will tell you that what are the differences in different recommendations. If you've read a Green Talk guideline, if you've read a NICE guideline, if you've read a talk article, here we are going to create the differences in the live session. And in the end, I want my students to make 10 pages. Myra would second me on that. 10 pages with all the bullet points of differences, and you learn those differences because otherwise you know everything which is essential for you guys. Yes, absolutely, Manahil. There are no separate talks. They're same as that of MRCOG Part 2. Yes, my dear Indrani, wanted to ask something. There was a hand raising, please. Apologies, I missed out while speaking. Anybody wants to ask any question? So let's
Yes, ma'am.
Yes, please. I'm here for the questions. Please, yeah, if any.
Yes, ma'am.
Absolutely. So much, my dear. Yes, please.
I just want to ask regarding my situation. I can finish my
Tura, the voice that you are with two devices, my dear. Be with one device. Yeah, now speak, please. Yes, Tura.
now it's okay.
No, it's too much of an echo, sweetie.
Just a minute.
It's an echo here, Batala. Sitwat, I'm just starting now, my dear. Today is the first session, which is an introduction, and then
It's
we're going to
okay.
have a gynecology.
It's
Yes.
okay now.
Yes, it's better. Hi, Radha. How are you doing? Yeah, I'm going to give you a link. Yes, please.
Yeah.
Back in team, can you please put the link? Myra, Safa, can you please help putting the link in the of MRCPI for the students, please? So that Ghada is asking for that and Sitwat is asking for that, my dear. Safa, sweetie. Thank you very much. Myra, put in the March registration link here. Kishwar, how are you doing? Please. Thank you very much. Yes, my dear, I'm here for the question, Thura.
Yes, ma'am. As I finish MRCOG part 1, but now I'm not working and I am in UK, but I have a maternity and I worked before in Obs and Gynae in Iraq. So what can I do for this situation? Regarding the
You've got 18 months of your
more than
perfect. So if you have the experience, just prepare an MRCPI Part 2 written now, and
Yes.
then MRCPI OSCE in the next exam going to be May 2024, and do your GMC registration and start working in UK.
Exactly. That's yeah. When you said it's okay for GMC, you give me
absolutely. Yes, this makes you have a GMC. Yes.
Thank you so much. But the regarding to the expression of to the experience, should we try it from my colleague in Iraq, or it's okay to do it from here? Because I don't know. Can you guide me, please?
For what, my dear?
For this, the experience letter or something like that.
Experience certificate would be your training, right? So if it was in Iraq, so you're going to get a certificate from Iraq only, sweet.
Yes. Is there a special form for that, or just ask them to do it?
Attestation?
No. This you mean this is the first one in the testimonial, the signature. Can my husband?
Yeah, this is your choice. Anybody who knows you here or anybody who knows there, that's not a problem. Anybody who knows you, my dear, can do that.
And for this 18-month experience, how can I improve that? There is a special form to fill it, or what I do?
No, this is just your hospital form. That's it.
Yeah. So
which they gave you on the letterhead.
Just to ask my hospital to make it for me.
Yes, absolutely. And that you have to otherwise get Thura because you'll need it for your assessment of training for MRCOG Part 3 as well, sweetheart. So you need to have it for both exams, okay?
And should be prepared now before December.
Yes. Everything which I've mentioned would be prepared now. We can't wait for the opening of the applications. We will do that now in the premium. You'll get it, check that everything is fine. Privately, you can message the coordinators that everything is fine. And then you're going to scan them and keep them because scanned copy would be uploaded. We can't keep the hard copies with us, right? It has to be scanned and a PDF should be saved on your desktop.
Thank you so much, Mom. Thank you. Always so
Thank you very much. Thank you, my love. Always there.
Hello, ma'am. I have a question. Hi,
yes,
ma'am.
my dear. I need to know your name because it appears
Sorry, ma'am. It was, ma'am. My name is Dr. Sohani. I have recently joined your fast track
for, my pleasure, Sohani. How are you doing today?
Ma'am, I'm good. Alhamdulillah. And it's really nice to have you here with us because, ma'am, I have a question.
Yes, now, please.
Ma'am, I have a question that I am appearing like in January for MRCOG Part 2. Recently, I have shifted in UK and I have given my MRCOG Part 2 last year, but it was just 2 marks difference and I had failed the exam. So now I want a GMC. So God forbid if I don't make it in January again. No, I'm trying my level best, but if God forbid I'm not making it, so I'll appear in March. So after MRCOG Part 2, I can join your MRCPI course like after that, because
Sohani, many students they do that. So it's side by side. But ideal would be you people can do it side by side also, and even after that as well. I mean, January you can do that as well. That's not a problem.
All right.
But the only thing is that I want that first you concentrate on one of the exam which you're doing for the January.
Yes, ma'am.
And then what you do is to all my sessions, you can register now because an off is going on. But if at all you want to register even at that time, what you'll do is you'll open my MRCT Part 2 sessions and then you'll add on stick-ons that these are the differences in certain guidelines, 8 to 10
So we can
guidelines.
do it after our exam because, ma'am, I want to concentrate on one exam right now. Obviously, yeah.
Absolutely. This is what
And
maximum students do, you know.
yeah,
This is
and
what
another question, ma'am, if we got an GMC with like MRCPI, so it is like after MRCOG part 2, we can do like senior fellow because I've also
Yes.
FCPS from Pakistan as well.
Okay.
So
Okay.
we got the job like with as we go and get after MRCOG part 2, or it's like an inferior level, or what is any their difference?
I won't say that there is a difference, but definitely yes, MRCOG, if you're working in UK, that is preferred as compared to MRCPI, but
All right.
students they want a GMC registration, honestly. So
Yeah,
when they
yes,
want a
ma'am.
GMC just to have get into the pathway.
Mhm.
So if you're just having, I won't ever say that after doing MRCPI you leave your MRCOG, you definitely have to complete that. But I always say that whatever is earlier, at least to get settled, you know? Whatever
Exactly,
is
yes,
going to
ma'am.
be sooner for you, that would be better.
Yeah,
So for
ma'am,
you
because
specifically,
MRCOG
I
is
would
part
suggest
2.
both of them, my dear. I know
Okay, so
it's
if I,
comparatively
inshallah,
difficult.
if I'll clear part 2 MRCOG, then again I have to give like MRCP. It's not like I, refund
No,
or
no, you
anything like.
should. Yes, you should, my dear. Definitely, yes, you
Okay.
should, because you should be in and there's another thing that MRCP OSCE has got a higher passing rate as well. And you can get the seat in
Okay.
May. So
All
MRCG 3
right.
would again be like you have to take, but I would definitely suggest very strongly that take both of them. Not a problem at all. So
Okay.
whatever
Okay.
gets you closer to the GMC as early as possible,
Inshallah.
Yeah.
Inshallah. Thank you so much. I will definitely,
Thank you.
ma'am, follow your advice. Thank you.
Absolutely, Swahani. Always
Jazakallah,
there,
ma'am.
my dear. Thank you so much, Waliaka.
Jazakallah.
Thank you, sweetie. All right, thank you very much. Yes,
Ma'am, I
please.
have a
So
question.
OET is must. It's not Sitwat about MRCP or MRCOG. OET is a mandatory requirement of GMC, and we all had to do for this. So OET is something separate, which everybody has to do. Sayyeda Sitwat, this is not about MRCP and MRCOG. It is a requirement of GMC. Okay, that everybody has to do. Sorry, Khalda. Yes, please. Khalda, hi ma'am, please, I should apply all my documents again. Khalda, you'll have to make it ready. If they give you a prompt, you'll do that. So if they don't do a prompt, then, but make it ready, please. I mean, we should be prepared. You never know. It's all the technical system, right? Okay. Absolutely,
Ma'am, I
my
have a
dear
question.
Manahil. I'll give you at least 8 to 12 students' names at the moment with MRCPI. They're working in UK after their GMC. So you can do that. Yes. The session is recorded and it would be uploaded as well. So needed after no. I mean, whatever training you've had, Nadia. Whatever training you've had, right? So Mariam, can I have where's the backend team? Safa, are you there?
Ma'am, MRCOG 2
Mariam?
booking started, so we can leave for booking and we can see.
Yes,
And
absolutely.
yes,
Is it started?
yes, ma'am. I have seen some people messaging, so I think
Because
we
1
can
hour
have.
is remaining. 1 hour is remaining. Is it
Yeah,
started?
but
Please do that. Please do that. Please do that.
yes, thank you so much.
Okay, thank you very much. Thank you. Listen to the recording later.
Yeah.
So,
Ma'am, I have a
Zaid
question.
Ali. Yeah, sure, my dear.
Ma'am, while doing MRCOG books, like if we are doing like mastering or Andrew Caesar, do we have to change the answers according to the Irish guideline? Means we don't have to rely on the answers given in the books because they are according to the
Sophia,
RCOG
not for all.
guidelines.
Sophia, not for all, but yes, 8 to 10 guidelines, yes.
Okay, madam. Thank you.
Okay, thank you very much. Priyanka,
And
comparatively much easier. Thank you very much, Islam. Lovely. That's great. That's great. Safa, get connected to the MRCD Part 2 people, please. The booking has started. Yes, it's recorded. So I'm talking to Ali here that it is, if you have done very early and it's been too much of a time for this, you can definitely do because the seats are more now. All right, the seats are comparatively more. All right, can I request the coordinator please to put the March link here, the students who are asking. So you're going to get the March link here. Whosoever is messaging me, please, this first WhatsApp number, you can message with all the queries who want whatever link. Also the MRCPI practice group, practice book link also, Nida, if you could send them. So once you register immediately, the team is going to get a notification and they will add you in the premium group. All right, this is how it's going to be. Now, any question regarding the booking, regarding the preparation, before I go to a glimpse of the topic of the day to tell you that how differences they come up in MRCPI. It's going to be a tiny glimpse to tell you guys that how the guidelines differ and what are those differences which make a change in our single best answers and later in the OSCE as well. Priyanka, as compared to MRCOG, I would say it's 60% of that preparation. I'm talking about the OSCE. And comparatively, the passing is also higher, sweetie. Priyanka, happy to see you here, my dear. Thank you very much, my girl. Praying for your health. Thank you so much. So I would do that, my dear. Can't do that in the live session, but if you people have any query, you people can do that. Thank you, my love. Thank you very much. So Tanmobi, if you could just drop in a WhatsApp here and show me the experience certificate, I'll be in a better position to just tell you that, yes, it's okay. You will book on the link, and as soon as the link comes, you're going to upload your documents. This Ali, you're going to open up the link and then you're going to upload the documents and then they will confirm. This time, it is payment is expected to be on the same day. So make sure that you're ready with your cards as well. We are going to guide in the premium group this, so that's not a problem. Okay. What other countries? Manahil? Yes, in maximum it is. So it is taken to be a specialist qualification. You are a specialist obstetrician gynecologist with this qualification, if I get your question correct. Yeah? Okay, thank you so much. So can we move to a tiny glimpse of the topic of the day? Everyone? And then I'm going to take further questions in the end if at all there will be any smaller question or any bigger question. Every question is welcome because that's what I'm here for and that's what we wanted to understand the system together. Thank you very much, Arbaba. All right, thank you very much. All right, so we have a new update on the practice guideline for the varicella in pregnancy. This was just updated in 2023. Yes, my dear Farheen. Hello, Tahani. Thank you very much for joining in. So in varicella in pregnancy, they've suggested and they have added on certain recommendations in Ireland, and certain changes are such big changes which make your SPAs and your OSCE station super different to that of RCOG. They say that we suggest that women planning to conceive or engaging with the fertility services, they should have their varicella status assessed, and that should be documented as well. All of you, ever in the preconceptional time period, in any part of the world, are we asking about any infection? If yes, what is that one infection which we always ask? Come on, you all know that. There's one, Kishwar, there's one infection which we ask always, right? Kishwar, what is that in the preconceptional time period? And that, thank you very much, Karima. I'm talking about the preconceptional time period. It's rubella. Rubella is recommended all over the world that we always, in the preconceptional counseling, we ask. Now, in Ireland, they have made a recommendation of the varicella that it would be part of the preconceptional counseling. Am I clear? It would be part of the preconceptional counseling that we are going to check her varicella status. This is a new update that we should be asking from her, Thura, that whether you had chickenpox or you've had the vaccination. They strongly recommend that women should have their immunity to varicella if they are not having the vaccination status updated, or if there is a concern that the patients, they have some sort of an exposure, if they're shaky that they had chickenpox and they're not sure of this, then we need to have the confirmation by investigation, that is IgG. This is Irish guideline, my dear, for MRCPI. Yes, definitely, yes, not RCOG. This is MRCPI, Irish guideline update year 2023. Either they should have 2 varicella vaccinations, or they should have a very solid and a confirmed history of having the chickenpox. So, National Immunization Advisory Committee, the NIAC guidance, they are doing a collaboration with, and they say that we are going to follow that for the varicella in pregnancy. Now, generally, the laboratories, they choose that whether we are going to send the IgG for a woman that's exposed rather than sending for everyone. If the patient is uncertain about her chickenpox exposure or having chickenpox in the past, we do recommend that their IgG should be checked. And if we are not sure that they are immune or not, we should be confirming that in the pregnancy and in the postnatal period, she should be vaccinated. So basically, this vaccination is not safe in the antenatal time period. So in the postnatal period, she should be vaccinated. Now, they recommend that this vaccination, which we're talking about, that should not be given during pregnancy because this is not taken to be safe for the pregnancy in terms of the fetal safety, right? We all know that varicella vaccination is always in the postpartum time period. It's never in the antenatal. The safety is a concern. Now, if the patient has got no immunity to the varicella, then during the pregnancy, we tell her that she should avoid children and she should be avoiding the varicella in terms of having an exposure to the ill patients as well. All right. Now, if a pregnant woman, she contacts a healthcare provider that I had an exposure, then here comes the history taking whether she's immune or not. And the guideline says in this situation, we need to ask her, did you have the varicella chickenpox history in the past or no? If she is confirmed that I had chickenpox in the past and now I had an exposure, that means what? If she had a previous chickenpox history, that means what? Hura, Arbaba, Manahil? That means that she is immune and she has IgG. So we reassure her. Now, my second question is Naima, Sophia Tariq, Ghazala Shaheen. If at all this patient, she is not having any history and now she has an exposure, what would you do? Okay, so if she's confirmed that she doesn't have an exposure, she's confirmed that she doesn't have an exposure. In chickenpox, we do not do IgM, we do IgG. Okay, so she is not having any positive IgG. It's nil, Ahmed Hussein. Naima, Garbo, it's nil. What would we do in that situation? She has an exposure, IgG is negative, no previous exposure. Now, what would you guys do to this patient who had an exposure to chickenpox without past history? Ahmed Hussein is my MRCOG boy. Yes, Maliha is my MRCOG girl. Manahil, thank you very much. Anthony, how are you doing today? So happy to see you. Anthony, IV immunoglobulin we were giving. That's my Ireland boy. Yes. Anthony Shepherd. Yes. Indrani, IV immuno. Anybody says anything else? All of you agree with IV IG? Happy to see you here. This is the 2023 update in chickenpox where they say that with an exposure, we would give oral acyclovir as first line option. And varicella zoster immunoglobulin we'll keep as an alternative, please. And this is the biggest difference in the recommendation which they've made for exam in year 2023. And I made just one line on this slide for you guys to remember. Now what they're saying in 2023 is that even if it's an exposure, we would give oral acyclovir. We will keep immunoglobulin, but as an alternative, not as the first line. And this is what makes it very different from the RCOG recommendations. Am I clear? This is how the guidelines that differ in tiny things for the single best answer. And this is 2023, just the recent update 1 month back. Absolutely, Mona. I'm going to show, and the day when it came, I made a flashcard on that because now they say, no, without Thura, one of them. Now they say if you have an exposure only and you're sure that the pregnant woman is exposed to varicella without previous history, please give a cyclovir. They're not saying that give immunoglobulin. They say that immunoglobulin is expensive. Eventually, if she would have a rash, we will have to give a cyclovir. Thank you very much, Hanadi. Hanadi is right. Our COG says we would give immunoglobulin first for an exposure. If she has a rash, we will give a cyclovir. Our CPI says if they have an exposure, we would give a cyclovir direct as a first line, and we will keep immunoglobulin as an alternative. Am I clear? This is how I would make a difference in the live sessions, highlighting those points which might be different. And this one single best answer is 100% coming up in your exam. Reason for that is this is what they've updated. I mean, they should be testing you on that you know the recommendations or not, right? For the baby, it is the same. If the fetus has an exposure to the mother, and if they say that the fetus has an exposure to the mother who has got a rash, would be given up with the neonatal immunoglobulin. But they say if it is a complicated chickenpox, like our COG having hepatitis, pneumonitis, encephalitis, some renal functions deterioration, then intravenous acyclovir would be given, right? They say the same, that immunoglobulin has got no role when the rash has occurred. So we need to take care of this point very, very carefully. In this situation, you need to remember that women with sepsis, when they are having the infection, disseminated infection, you people have to give the intravenous acyclovir. So when the patient has got complication, then oral acyclovir would not be chosen, but this is not different. This is the same which you guys know from your RCOG as well. That's absolutely the same thing. When the patient has got a rash or a symptoms, 8 to 21 days, she stays the infectious for 8 to 21 days post-exposure. And 8 to 28 days if she has been given varicella zoster immunoglobulin, so 7 days more. This is the same recommendation which you have in the Green Top guideline, chickenpox, varicella zoster infection as well. When we have the varicella in pregnancy, they say that we can have the check for the baby to rule out the varicella, fetal varicella syndrome. If at all she is prior to 20 weeks, we do that in 16 to 20 weeks, the fetal medicine specialist check. If at all she comes up at any part and she has a varicella infection in pregnancy, 5 weeks after the infection, we need to have the fetal medicine check, and we need to check for the anomalies or any sort of a concern for the fetus to be sure that whether it has involved the fetus or not. So at least 5 weeks gap to be sure that it has affected the fetus or not. All right. Now with this, the basic change which we have in the algorithm is the same, which says regarding the acyclovir versus varicella zoster immunoglobulin. If at all the patient, she comes up with a preterm infant, they are less than 28 weeks, or the weight is less than 1 kilogram birth weight, then we should be knowing that these are high-risk babies for infection. These are high-risk babies for having the varicella infection and preterm complications as well. All right. Now, how many days we need to avoid the birth plan for the immunity from the mom to go to the fetus? Maliha, Rania, Hanadi, how many days we need? We need 1 week time, 7 days. So generally, those who are born within 7 days of the rash or within 7 days after the birth, she has a rash, we are concerned that these babies are affected in terms of an exposure, and we require varicella zoster immunoglobulin. So 7 days is basically required for the antibody transfer. Now, they give you a single best answer, and they say that the patient has got a chickenpox rash today, and she goes into labor on the 4th day. So this baby will be getting the neonatal varicella zoster immunoglobulin. Got that? Similarly, if she's giving a birth today and within 7 days gap, mother gets a rash, even then baby is exposed. So these are the concerns which we have to remember from this guideline. When you go to your premium portal, all the 2023 recommendations are there with complete updates. So it was just in 24 hours, and that's a complete separate folder, the 2023 guidelines, all OSCE MRCPI students and the students who are in the written course. You've got all updates separately on your website saying 2023 recommendations. So those guidelines are separate in a folder so that you know that these are the most important and the recent updates are there. All right? Absolutely, my dear Naima. Then it's not required when it's more than 7 days. Yeah, but then it's no exposure. So we give acyclovir generally to those patients, to those babies who develop varicella, who have the infection. But for shingles, because it is going to be a recurrence, so the babies are already immune, the mothers are already immune, we can consider, but it's not a recommendation if the mother has shingles and then the baby is born. But we can consider, we can suggest case-to-case basis depending upon that how much the requirement is. So if you see here, this is a wonderful flashcard which we made when the guideline was published. So if you start here, they say that maternal history of varicella zoster is there. You should be asking whether she had 2 doses of the vaccination or the maternal history of varicella zoster. If she has a maternal history or she has 2 vaccinations. Thank you very much, Madina. Happy to see you here. So you're going to assume immune and she does not require. So you're going to select, in this case, reassure in your single best answer. The patient who's already immune either by 2 vaccinations or by her history itself. All right? On the other hand, if she doesn't have a history or she's not having a vaccination, so you would test her varicella zoster. Please select immunoglobulin IgG only. IgM is not done in this situation. Am I clear? IgM is not done. Only IgG for the single best answer. Now, if we get the IgG report of 100 milli-international unit per ml or more, so we again select reassure. This SBA is reassure here. This SBA is reassure when the levels of the immunoglobulin IgG are 100 and more. Are you guys with me? If it is less than 100 milli-international unit per ml, now I need your attention. Everybody has to see that, read that with me. So it sits in our neurons and it's very clear because it's a potential exam question. And it says, and I read from 2023 update, administer post-exposure prophylaxis with acyclovir 800 milligram 4 times per day for 7 days and start the course on day 7 after exposure. Can be started up to day 14, but ideally within 7 days. Please keep in mind that varicella zoster immunoglobulin can be used as an alternative if required. So if you remember this one block and you put a stick on your already made varicella in pregnancy notes and you put this one stick on, your guideline is prepared. You have read chickenpox in your qualification for your countries. You have read chickenpox so many times. Many of you have read the Green Top guidelines. I want you to add this one block and your chickenpox is ready. and you would see that the similar question you would find in your exam. Am I clear, everybody? What I want and what is my way of preparing your notes? Yes? If this baby is born to a mother, this is a varicella zoster immunoglobulin in neonates exposed to varicella zoster virus. Is mother varicella index case? Yes. If the rash onset is 7 days before or within 7 days after birth, then you're going to give varicella zoster immunoglobulin to the neonate, please. Why? Because the baby is exposed, right? But if there's a situation where the contact, she's not the index case, and the contact is 48 hours before onset of varicella or zoster rash, you're going to see if it's a premature baby, just contact the MDT and decide. And if it's a full-term baby and it's been within 7 days, if mother is not the reason, but there is another reason where the exposure is there, to baby, you will do varicella zoster immunoglobulin. If it is positive, then of course, like mother, the baby is immune, not to give. If it's negative, then give varicella zoster immunoglobulin to the baby within 10 days of exposure. So if the baby has got an exposure, you can also check baby's varicella zoster immunoglobulin as well. Am I clear, please? Did you guys understand? So if you do these two algorithms and you highlight the recent updates, you people would not have any sort of a difficulty, please. My idea to see you today, to tell you that how you have to make your notes. I don't want you to start from zero. Wherever you are with your previous qualifications, we'll take a start from there only, and we'll add on the differences on those notes to make it ready for MRCPI. There are 8 guidelines which are different and 3 recent recommendations. The entire SUI stress urinary incontinence is the same. The only difference is the duloxetine is first and birch comes second. If you remember these tiny points, you people would not miss this exam. And you would start loving these recommendations when you start practicing these recommendations and applying the knowledge on your single best answers. The mother post-exposure, first line is cyclovir, newborn varicella zoster immunoglobulin. Thank you very much, Arbaba. If you remember these 2 lines, your SBA is done. And at the end of the day, exam is what we need to clear. Very well done, my dear. Could I give you the hang of the preparation today? Did you guys understand that how it's going to be? Yes. This is how you people will add on these 4 alphabets with your initial qualifications and things will be clear. Our fit hearers, centrally mentor, we all are here with this preparation, trying to tell you that it's something which is doable with the same effort. Slightly changes, and with that, you can just do this sitting at your home at the test reach on your very own laptop. You can appear in this exam and make it a success, please. Any questions, please? You all know the link. I'm getting so many WhatsApp. If anybody wants to have any of the query, please. Thank you very much, Anthony. Happy to see you here, my dear. Thank you so much. So for you, it's essential, my dear. So all the Irish trainees, please get connected. Specifically, you have to, everybody has to make a success, but for you guys, it's essential. There's no point that you don't get to see their separate training seats for you guys, and you all have to get it. So everybody just get connected for that, please. How to get RCPI book of you. Arbaba, drop in a WhatsApp on this first number, please. I'll send you the link. All right. Or the coordinator, please put in the link here. Arbaba wants to get the single best answer book. Fast track of MRCPI after join, can I join? Reen, anybody can join. Yes, the fast track, but I do the fast track same as out of the regular. I won't have my sessions there. Reen, I mean, the regular sessions won't be there. You know that the module wise, right? It would be the question and answers, exam questions starting from 2015 till 2023 September. Read, that's what I do in the fast track. You know that, right? Similarly, yes. So I will start it 4 weeks before the exam. Kishwar, no, you have the, I think, RCPI book. Kishwar? RCPI book is the single best answer for the RCPI. You don't have? Okay, just drop in a message. I'll send you the link. Okay. Okay, thank you so much, Naima. Happy to have you here, my dear. All right, so the premium course students, please, what time are we deciding? Thank you very much. Kishore, here's the link, sweetie. No, Farah, up till now didn't make. I'll make it somewhere, I think in January. Yes. Thank you very much, Misra. Thank you very much, Ahmed Hussain. So happy to have you here. Thank you very much, Misra. If anybody wants an RCPI book of RFA, you people can have the link here. Coordinator, if you could put the link again, please, for the RCPI book. Whosoever wants that single best answers. All right. Thank you very much. Short notes, no Kishwar. That is ebook of the MRCG Part 2 Fast Track. Can I have the book link again in the chat, please? You just click on that link and you can subscribe to that book. That would be till March 2024. You'll have the access. All right. I think I'll have to 2 p.m. GMT. Everybody's happy with 2 p.m. GMT, everyone? Okay, just hold on. I'll put in the link again myself. So, Okay, so we changed few settings here. Two p.m. GMT is okay? Okay, perfect. Thank you. Sophia wants early. Amnawad wants 3 p.m. You guys would be sleepy then, all those who are in the India. It becomes late for the India and Bangladesh students. Yes? Okay, fine. All right, we'll keep it 2 p.m. then. All right. Thank you very much, Naima. I've sent, my dear Razita. I've sent the link. Please see. I've sent the link. 210 is the link number. All right. Thank you very much. Thank you. I'll just put it on my status as well just now. Okay. You people can take it very, very well. Thank you very much. Thank you, Tura. All right. So any questions, any concern? Maliha, just all the topics of the daily discussion, the coordinator is just going to put now. Okay, sure, Siham. We are going to meet 2 p.m. GMT. So we are going to start with the first module, that is gynecology. And Myra, get connected to Binte Hawa as well. And please put the first topic so that they start reading from tomorrow. And the daily discussion timings also tell them for the guideline. All right? Okay, thank you very much. Says Ali, you can drop in a WhatsApp, please. I cannot help you in the chat box. Please drop in a WhatsApp in the first one. Anybody who wants to subscribe for the ebook can take it. Thank you very much. Thank you, Maliha, for the prayers. Maheen, everyone who needs it can subscribe, not an issue. All right, there's a link where you can just register to that. Okay? All right, thank you very much. Any questions? Anything which you people want to ask, please? Thank you very much, Samsung. Thank you. All right, any questions, please? Absolutely, absolutely. All those who are joining today, more than welcome, because we are going to start with the first module from tomorrow, and all the discussion would be there in the premium group. I want you to be on the champion list. You all can do that without any sort of a hesitation. With this firm belief in yourself that you all can do it, this exam has to be a success, Kishwar, inshallah. Thank you so much. Thank you. All right, friends. So best of luck from the entire team of RFA tutors. For any concerns, any queries, please put in the WhatsApp for the first number. I'm going to be there at the moment. Yes, once I'm not in the live session, I'm using this number. The backend team is 24/7 available for you guys. To all my Ireland students, best of luck. We have to make it a success. Again, this is an essential exam for your qualification. You have to do it. And for all those who are taking it from different parts of the world, thank you so much for this massive trust on us. And we would work 24/7. I need your 200%. Definitely, yes, you would be standing besides, but I want this firm faith in yourself that you can do it. And we are going to make a success together. RFA Early Bird. Ghada Babikar, without space, please. RFAEARLYBIRD. RFA Early Bird. So you're just going to put that and it would work. Thank you so much. Any queries, any concern, you can drop in a WhatsApp. The team is there. I'm available. Thank you very much. Bye-bye from my side. Take good care. See you guys in the premium group. Happy studying with RFA family. Hands in hands, let's make it a success together. May the blessings be with you guys. Thank you so much. See you guys soon. Thank you. Bye-bye. Thank you very much.